Good morning, everyone, and welcome to today's Chambers Weekly Teletown Hall. It's July 15th, and it seems a little bit strange this morning to be saying Happy Tax Day, but for those of you who have might forgotten, today is actually Tax Day. So not only is it Tax Day, it's also summer in the South, and as temperatures continue to rise, and we're in the heat of it, and before long, we'll all look forward to seeing some cooler temperatures, I'm sure. Our world continues to change almost daily as we move forward during this pandemic. And the one constant that remains the same is the need for current, unfiltered information from those on the front lines in business, medicine, education, tourism, government, and finance. Facts over fear has never been more critical than it is in today's world. We're pleased to see the thousands of listeners who join us each week directly on the call, as well as via social media and with our partners with the County Channel. And also, speaking of partnerships, special thanks to Lowe's for their donation and partnership with the Chamber. In the last week, your Chamber's distributed over 3,000 masks to businesses and nonprofits who need them for their staff and their customers. We're also continuing our mask distribution efforts for visitors at resorts and grocery stores, reminding them to mask up while in the Low Country. There's no shortage of questions about how this pandemic continues to impact our economy at a national, state, and local level. There are also a lot of questions this week surrounding the preparation of our hospitals and healthcare facilities. These are just some of the topics that we'll be discussing today. When it comes to marketing the Low Country, that our number one economic driver is tourism, and everything we do at the Chamber is based on research. This morning, we're joined by one of the industry's leading researchers and the Director of Office of Tourism Analysis at the College of Charleston. We're delighted to have with us this morning Dr. Daniel Gutentag. Dr. Gutentag, thanks for joining us.
Thank you.
Good to see you. We look forward to hearing your remarks this morning.
Absolutely. Thank you for having me.
Yeah, thank you. The show's all yours. If you want to share your screen or anything that you'd like to do, again, welcome, and we'll turn it over to you.
Okay, sure, absolutely. Yeah, if everybody can bear with me for one moment as I get the screen share going. All right, I think everybody should be able to see it. If not, I need everybody to scream at me at once, because it's always my terror that I do one of these webinars and I'm halfway through it and I realize I forgot to share my presentation. But
we see it.
All right, excellent, thank you. So yeah, thank you very much. Once again, I'm Daniel Gutentag, Director of the Office of Tourism Analysis and Professor in Hospitality and Tourism Management at the College of Charleston. And today I'm going to be speaking about some of the impacts that the COVID-19 pandemic has had on Hilton Head Island's tourism sector. And that's going to include a description of an analysis we did of the economic impacts in particular that we did for the Chamber of Commerce. So firstly, a big thank you to Bill and Ariana and everybody else at the Chamber for inviting me to speak to you today on this webinar. And I really commend them for their interest in research and data during this really uniquely challenging period. So to put things in perspective and get started, I want to talk about just how unprecedented this period really is from the perspective of the hospitality and tourism sector, really throughout the world. So the three charts that you see here were produced by the American Hotel and Lodging Association. And what they do is they're showing the impacts of the current pandemic on hotels in comparison with the most two recent crises that have impacted the sector. So before that, we had the 2008 recession, and then before that, we had 9/11. And what each one of these charts shows are two different variables. So one is the impact that these different events have had on hotel occupancy. That's the blue line. And when we talk about hotel occupancy, we're just discussing the percentage of rooms that hotels are filling with paying guests. So if you have a hotel with 100 rooms and you sell 75 of them last night, then you're 75% occupied. So that's the blue line. And then the red line is showing the impacts that these events have had on the employment in the hotel industry. So essentially the jobs that have been lost. So what we can see if we look at the three charts together is that both the blue and the red lines are going way further down. They've been impacted far more severely by the current pandemic, as you can see in that right-hand chart, than we saw either after 9/11 or in the '08 recession. And in fact, not only do the numbers sort of dwarf what happened previously, but if you look closely on that right-hand chart, you'll actually notice that they even had to expand the axes. So for example, looking at tourism employment, the first two events, they only go down to up to 2 million jobs lost, whereas the current one goes all the way down to 6 million jobs lost. So there is no denying that the impacts of this pandemic truly are just extremely significant, and far more so than any other event that really we have experienced in our lifetimes previously. And those impacts have been felt throughout the world, really, throughout the country, throughout South Carolina, and that includes in Hilton Head. So this chart shows hotel occupancy rates. So that's what we're seeing. The 0 to 100 there is 0% to 100% for each week, essentially for the first 6 months of the year, both for 2020 and then last year in 2019, which sort of shows how 2020 compares to a more typical year. So not surprisingly, what you can see is through those first sort of 2 months and change of the year, things were relatively similar between 2020 and 2019. But then mid-March came around, the pandemic hit, and everything sort of went down a cliff. So we had occupancy drop to very, very low. It stayed that way for roughly until about May. And then in May, you saw the recovery begin, and recovery went essentially throughout May. And by June, you're back up to almost where you normally would be. And sort of throughout June and into July, seeing that those numbers are trailing 2019 by about 7 percentage points on average, roughly each week, but still sort of a lot of recovery seen and much closer than we had just a couple months ago. But you do have sort of that 2.5 month period there where the impacts were just very, very severe. And again, this is not unique to Hilton Head in any way. And in fact, this is not the complete picture. And one of the advantages that Hilton Head has, and I'll talk about this a little bit later, is that you have a lot of vacation rentals, and actually vacation rentals have been performing better than hotels. So actually the reality is the picture's a little bit rosier than this chart suggests, but I still like it because it really illustrates just how incredibly challenging, especially that period in, say, late March, April, and May has been, again, in Hilton Head, and it's representative of really everywhere. So then when we take into consideration sort of the loss of all these visitors, what does that mean for the overall economic impacts? Well, when we talk about economic impacts, there's a few things that you need to keep in mind. So one is you normally have your visitors come and they have their direct spending. So a tourist comes and they're going to pay for their hotel or their rental or whatever. They're going to go eat at restaurants. They're going to spend money in retail shops, maybe pay for golf, et cetera, et cetera, et cetera. So those are their direct expenditures. But when we're thinking about economic impacts, we need to think about all of the secondary effects of those direct expenditures. So as an example, when the hotels are full and the restaurants are full, then they're spending more money on cleaning supplies, and they're spending more money on food and alcohol, and they're hiring more staff, and then the staff is earning their salary and they're earning tips. And then they're taking that money and they're going to get haircuts, which is what I really need. And they're going to the movie theater and doing, shopping, going shopping for shoes, just whatever, the normal daily economic activity. And so whenever you receive tourists, their expenditures result in these sort of compounding benefits throughout the community that really benefit essentially every other economic sector in the community. And then the flip side of that is that when you don't receive those visitors because of an event such as the pandemic, you lose not just those direct expenditures, but all of those secondary impacts as well. So that's essentially what we did with some economic impact modeling. And we looked at the first 4 months of the pandemic. And all combined, we estimated that the total economic impact loss was just over $300 million. And this is the economic impact on all of Beaufort County, but based solely on the loss of tourism on Hilton Head Island. So over $300 million, so very significant. When we then put that into the context of tax losses, there are significant losses at every level of government. So about 15 million at the local level, up to nearly 27 million at the federal level. And that then includes nearly $8 million in tourism tax losses. So these would be things such as accommodation taxes, hospitality taxes, that I know are used for in a lot of different ways to benefit the community, such as beach renourishment, supporting cultural and arts organizations, and so on and so forth. So once again, the impacts to tourism really are in no way sort of segregated to only tourism. They're much more widespread, and they have secondary impacts throughout the economy. So then we additionally looked at job losses. So for job losses, we looked at what were the impacts in April, because this data is sort of rooted in data provided by the Bureau of Labor Statistics, and they're a little bit slower in offering their data and publishing it. So it's harder to get a good feel from their data of what the recovery looks like. But what we can do is look at what were things like sort of at the peak of the downturn in April. And so we looked at just the accommodation and food services industries and looked at both Beaufort and Jasper counties, because once again, that's how the Bureau of Labor Statistics publishes all of their data, even though we know the majority of that would be in Hilton Head. So anyways, taking all that into consideration, we estimated that just over 50% of the accommodation and food services jobs were lost in April, and that's over 7,500 jobs. Now, again, this was in April, so there is no question that many of those jobs have undoubtedly returned, but at the same time, it's certainly not all of them. So the impacts are absolutely significant. And once again, these are occurring everywhere. But on that same token, the reality is that given the circumstances, Hilton Head has actually fared very well given what's going on and in the current pandemic, and is positioned very well to continue succeeding despite the challenges. So the reality is, during a pandemic, travel is just lower across the board. Fewer people are traveling, they're taking trips, so the pie is smaller. But again, Hilton Head is very well positioned to capture the tourism that's occurring. And that's for a few different reasons. So one is that if we think about some of the attributes that Hilton Head has, it's very aligned with the sort of travel that people are interested in and taking these days. So what do people want to do largely? They're interested and willing to do outdoor activities where they feel that it's safe and they feel they can do their distancing. So this would be things like going to the beach, playing golf, playing tennis, all things that we associate with doing in Hilton Head. Also, Hilton Head has a very strong drive market, which is really important right now, that many people continue to be reluctant to get on airplanes. And in addition to that, you just have fewer flights that are being run after the airlines really pared down their offerings a few months ago and are starting to ramp back up, but not completely. So the drive market is really, really critical. And what we're seeing right now is that not only are people turning this into a summer of car trips, but they're willing to drive further than they normally would be. So going into it, a lot of people were theorizing or hypothesizing that, oh, everyone's going to want to take car trips and it's going to stick within just 2 hours of home. Turns out that the car trips part is absolutely right, but staying within a couple hours of home turned out to be completely wrong, and that people are willing to drive even further than they normally would be, just because many still want to have that summer vacation, but they don't want to get into an airplane. Also, as I alluded to earlier, the vacation rentals. So Hilton Head receives a lot of its visitors who stay in vacation rentals, much more so proportionally than many other destinations. And I don't know precisely why it's the case. I think one reasonable hypothesis is that some people at least, are attracted to the vacation rentals because they feel as though they offer a bit more privacy. You're not running into other guests in the hallways or the elevator or what have you. But anyways, regardless of why, the truth is that the vacation rental market is performing stronger than the hotel market right now. And actually, in some of the most recent data in Hilton Head, we're seeing that the vacation rentals are really doing essentially just as well, if not slightly better, than they had in 2019. So the large inventory of vacation rentals that exists in Hilton Head is really a strong benefit right now. And also your visitor profile, you have affluent visitors. And so these individuals are less likely to have been personally sort of severely impacted by the economic impacts of the pandemic, in the sense of perhaps losing their jobs and things of that nature. Also important to note some things that Hilton Head is not, and these things are attributes that are challenges for some other destinations. So you're not a dense metro area. So just like people are interested in outdoor activities, a lot of people are a little bit reluctant to go to a huge urban center right now, where things like distancing are much more challenging. Also, Hilton Head is not dependent on massive events. You're not dependent on these 10, 20,000 delegate conferences and large events that really are the bread and butter for some destinations in the US. And then lastly, you're not reliant on international visitors. As we know, there just is not a lot of international travel going on. So we can see that then in the data. So this chart here shows the occupancy levels in May for the entire US, for South Carolina, and then Hilton Head on the far right in comparison with some other nearby coastal destinations. And what you can see is that Hilton Head outperformed the country, the state, and some of these other nearby coastal destinations. So again, really strong performance, taking into account the circumstances that we're dealing with, and also remembering that this is May data. The numbers are much stronger now into June and July. And again, this is not the whole picture, because this is just hotels, not the vacation rentals. But regardless, I think it does a very good job of sort of illustrating the success that Hilton Head has been having. So the final thing that I'll wrap up with is, looking forward, I think it's abundantly clear that we're still very much, unfortunately, in the midst of this pandemic. As Bill sort of said at the beginning, the ground continues to sort of shift from underneath our feet practically every week, if not every day. It's just a constantly evolving situation. But we will be continuing to monitor things as they arise. And I think the important thing is just to remain flexible, remain nimble, and be ready to adapt to things, to new developments, essentially, as they unfold. And I know that the Chamber will be there with you along the way. So with that, I will wrap up. I want to thank everybody for their attention today. And I think we'll open it up for questions if anybody happens to have any. I'd be more than happy to do my best in answering them.
Dr. Gutentag, thank you so much for that great presentation and the explanations. First question comes to us from Andrew this morning. And Andrew is asking, how will the constant fluctuations in COVID-19 recovery continue to impact jobs?
So in terms of maybe the infection rates, I think the nature of the question is not knowing what's going to happen. How will it affect jobs? That's a great question. Right now, I think, we've sort of entered the high season. So I think a lot of people are hiring and sort of trying to make sure they have what they need for the summer and the fall season. Whether that hiring sort of continues, again, it's hard to sort of say. Anything I'd be saying is pure speculation, because the Bureau of Labor Statistics has a huge lag in their data. I would imagine that, like many things, sort of the uptick in hiring that we saw in June has probably, and May and June has essentially plateaued to some degree. I know in Hilton Head, there are also some challenges with regards to visas and things of that nature. And then I think the question is, how long can we keep it going, basically, and what happens with the pandemic moving forward? I think everybody wants to make sure that they are staffed up and ready to sort of manage and offer their services to any tourists. But we just don't know moving forward. Certainly things always slow down a little bit in the winter. And I think the hope will be that businesses continue to keep their employees on into that fall and winter season as long as they normally would.
Okay, thank you for that answer. The next question comes to us from Bob. And Bob's question is, are there projection models going forward accounting for the continued shutdown of arts and culture, festivals, etc., in light of the continued bad COVID numbers?
Yeah, great question. The answer is no, there is not really. I mean, certainly when we do these sort of analyses, sort of on a local level, we're always trying to take into account as many things as possible. But certainly, more broadly speaking, one of the challenges is that the impacts are so localized. I mean, the situation in Hilton Head is a little bit different than it is up in Charleston, which is different than Myrtle Beach, which is certainly different from as we go further up or down the East Coast. But certainly that is something that everybody, businesses and destinations are going to be needing to adapt to, is that, again, the type of travel is going to be a little bit different, that some things that people previously traveled for are being canceled, or tourists just aren't as interested in it, whereas other things they're particularly interested in. I mean, I would say that undoubtedly there's some substitution effects going on, as say some people are saying, oh, I was going to fly to Vegas this summer, or I was going to Spain this summer, but I don't really want to, well, I can't go to Europe and I'm reluctant to get on an airplane. So now let me drive 4 hours and go to Hilton Head and spend my vacation on the beach. So there are opportunities to sort of pick up things that have been lost elsewhere as this sort of replacement and substitution phenomenon occurs.
All right, thank you. The next question comes to us from Marty, and Marty is asking, how does the 310 million total economic impact compare to 9/11 and recessions of 07, 09?
Great question. I did not do similar impacts for either of those two prior events, so I really can't speak to it. But I would almost guarantee, I mean, going back to that first slide I showed, that the at least if we're looking at the first 4 months, which is what that analysis was, that the impacts would be much more severe for the current pandemic. That the occupancy levels in hotels, even right after 9/11, did not fall off a cliff like they did sort of in April as the whole country essentially shut down. So again, I don't have hard figures to offer, but I can essentially assure you that the impacts of COVID pandemic in those first several months were more significant, and probably much more so. In other words, not just marginally so.
Thank you for that answer. Next question for you, Doctor, comes from Nancy. And Nancy is asking, as schools move online, do you see the tourism season extending beyond its typical time?
Yeah, that's an interesting question, because it literally crossed my mind yesterday. I have two little kids, both who will be in elementary school, and as I think about what's my world going to look like in the fall if I'm teaching online and my kids are learning online, I was like, wow, we would actually have the opportunity to go somewhere and do something, and there's really no reason not to, in the sense of, you normally have that strict day, school starts and you're back home for sure. So I have not heard much chatter about it, but I would think that it definitely is a possibility, as people who have families that have one or especially both spouses working online, or regardless, they can take a week of vacation and know that their kids can do online school if that's what's happening for who knows how long. I think it is a very realistic possibility, and that we are not going to see sort of the maybe stark change between school year and non-school year like we maybe normally would. So yeah, I think it's something to be thinking about potentially capitalizing on for sure.
Okay, thank you. Next question comes from Connie, and Connie is asking about the $300 million plus economic impact loss for all of Beaufort County, and then how did that break down for Hilton Head Island?
So the impacts are based on the tourism on Hilton Head Island, but we didn't do a separate analysis of just Hilton Head Island. The reason being, I think, sort of as I was describing, it's important, and I think it's more realistic to look at the impacts more broadly when we know that what happens on Hilton Head Island has an impact on other sectors and on other areas beyond the island. So if we were to do just Hilton Head Island, again, the reality is the impact would by definition be a little bit smaller, although undoubtedly, because we're looking at tourism on Hilton Head Island as the driving factor behind the impact, there's no question that the bulk of that impact would be on the island.
Okay, thank you for additional explanation on that. Dr. Gutentag, I think that concludes all of our questions this morning for you. It's been terrific having you with us this morning, and hopefully we'll be able to have you back on at some point in time for some more analysis and updates.
It would be my pleasure. Thank you so much for inviting me to speak to everybody today, and thank you so much for the great questions.
All right, thank you. Have a great day, Doctor. You're welcome to stay with us, or if you need to run, we'll talk to you later. Thank you.
Wonderful. Thank you so much.
And one of our key partners in this recovery, as well as on everyday life, is the hospital system. And we're proud and pleased to have with us again today the market CEO of Hilton Head Regional Healthcare, and that's Jeremy Clark. Jeremy, welcome back, and glad to have you on for an update this morning.
Good morning, Bill. Thanks for having me back. I appreciate it. As we've said in previous weeks, Hilton Head Regional Healthcare continues to operate effectively and safely. To start off this morning, I wanted to give everyone an update on what we're seeing both in our hospitals and in our community. At Hilton Head Hospital and Coastal Carolina Hospital, we currently have a total of 25 COVID-19 patients hospitalized in the two hospitals. That includes 2 patients that are in our ICUs. This is an increase over the last few weeks. However, we still have capacity in our medical beds and also our critical care beds. We continue also to see more COVID positive patients in the community as well. The majority of these individuals are local residents. There are very few individuals from out of town. And thus far, most are continuing to have symptoms that are lower acuity and do not require hospitalization. However, the average age of those testing positive is continuing to increase. So that's one of the trends that we are watching very closely. So I want to remind everyone that this remains a very serious disease, and everyone needs to remain vigilant. Please continue to wear a mask, wash your hands, keep your distance from others. I also want everyone to know that as the number of COVID positive patients increases in our hospitals, we remain ready. We have very well-developed plans, well-rehearsed plans that we can implement to add capacity for beds, staff, and ventilators if we need that. We are very well supplied in our personal protective equipment, our PPE. My team and I are meeting regularly to assess the local situation in the community, the situation in our hospitals, and evaluate our plans. So as the local situation here changes, we can implement the plans that allow us to continue to provide safe care to all of our patients. So we have some good plans. I feel very comfortable in that. But more importantly, we have great people. And just seeing everyone coming together over the last few weeks or a month or so has been really incredible to see the nurses that are taking care of these COVID-19 patients just donning and doffing their personal protective equipment all day, seeing other staff, other nurses taking on extra shifts or performing nursing assistant duties to help out has been really incredible to watch. Many of our physicians are stepping up into leadership roles. It's just been really great to see, really incredible to see everyone coming together during these unprecedented times. So I mentioned testing earlier. I want to give everybody a little bit more details on that. So we are currently performing over 1,000 tests every week, 1,000 COVID-19 tests every week, most of which are being done in our outpatient drive-through testing, which is conducted at each hospital every weekday morning. At these events, any patient with a physician order can show up and be tested. No cost to the patient, no appointment is required. So that's something that we're offering. And as I said, we're seeing over 1,000 patients a week at this point. We're also partnering with some great partners in the community to offer regular testing events. And these major testing events are also free, no appointment required. And at these events, no physician order will be required either. We've got quite a few coming up over the next few weeks. The first one that we have scheduled is July 19th at St. Stephen AME Church in Hardyville. We also have one on July 22nd at Bluffton High School, July 31st at the Second Utah Baptist Church in Ridgeland, and then August 5th back at Hilton Head Island High School. All of these events are, again, free to the community. No physician orders required, no appointment is required, and all of these events will take place between 7 a.m. and 11 a.m. You can check out our Facebook page for more information on each of them. But I'll tell you, we are very fortunate to have great partners in the community to help us make these events a reality. Staying on the topic of testing, we've also made more testing available to our employees. Our colleagues are now able to get a rapid test if they believe that they've had an exposure, or if they've picked up something in the community. They're able to get this rapid test, get results back in within a couple of hours. And this is one component of maintaining that safe environment, creating that safe environment, and then maintaining it inside our hospitals. But testing is just one component of creating a safe environment. We continue to screen all of our patients and visitors and staff. Everyone is wearing a mask. Temperatures are being taken as well to create that environment. We are spacing our patients out better, both in the waiting rooms, but also with the use of private rooms throughout our hospitals. We're cleaning more and using a lot more hand sanitizer, making that available to patients and visitors, as well as our staff. So I feel very confident in the safe environment that we've created, a safe environment both for our patients to receive care, but also for our colleagues and physicians to deliver care in. So while we are seeing more COVID patients than we have in the past few weeks, it's still good to know that the vast majority of patients that we're taking care of are not here for COVID-19 related illnesses. We still have plenty of patients that are choosing us when they need emergent care, patients that are choosing us for elective surgery, patients that are choosing us to deliver their children. So it's really good to see that we're able to do that. We're able to provide that high quality care because of the safe environment that we've created. So to wrap up, I just want you to know that our hospitals remain ready. We've created that safe environment to provide care today. We are seeing numbers starting to increase, and as those numbers increase, feel very confident in the plans that we have to continue to operate effectively and safely. We appreciate the leadership from our state and local officials. We appreciate everyone's support for our caregivers. That's incredibly appreciated. And I just will remind everyone to continue to wear a mask, wash your hands, keep your distance when you're around others. So, Bill, I'll turn it back over to you, and I'll take any questions if there are any.
Okay, Jeremy, thank you. The first question is from Fred. And Fred is asking, in the testing, are patients only contacted if they test positive? So after they're tested, are they only notified if they test positive?
No, we are contacting all patients, whether or not they test negative or test positive.
Okay, thank you. Next question comes from Julie, and Julie's asking about elective surgeries, if the hospital's still performing elective surgeries.
We are still performing elective surgeries.
All right, and the next, not a question, but just a statement from one of our listeners this morning, just saying thank you to you and your team for the great job that you all are doing on a daily basis. And
thank you. We have incredible people here. It's been outstanding to see throughout this event over the last few months. Thank you for your support.
Jeremy, thank you again for being with us this morning. Thank you for the updates. They're very, very important to our community, and the leadership that you and the hospital demonstrate is greatly appreciated.
Great. Thank you, Bill, for having me.
You're welcome. Have a great day.
Yeah.
We'll switch now to our next speaker, and our next speaker is Rebecca Leach. Rebecca is the Executive Director of the South Carolina Retail Association, and we're delighted to have you back with us, Rebecca, and know certainly the many challenges that you and your team and your members have faced, and look forward to hearing more about that this morning.
Well, good morning, Bill. Thank you so much for having me again, and appreciate your support of our retail community. We definitely have seen our challenges throughout all of this, but I'm proud of our retailers and what we've done throughout this crisis to continue to offer these essential products and services as we ebb and flow and figure out how to operate under these new conditions. So we continue, to remain open. Most of the retailers are open. Some still have voluntarily chose to remain closed as they figure out how to re-enter the market. Of course, we all have our social distancing and mask requirements as different ordinances require. And so a couple of challenges that we're currently facing, as I just mentioned, the mask ordinances in general throughout this entire crisis. Um, Local emergency ordinances have been a challenge for our state's retailers. Just because with emergency ordinances, they're done very quickly. They're done oftentimes without the normal 24-hour notice. And so it's a very difficult thing for our association and our members to keep up with who is doing what. And so with there being no central repository of these emergency ordinances, it makes it a challenge to figure out what's required and where. And honestly, my biggest friend is Google, and that's how we find out these things. So that continues to be a challenge. And so right now, the topic of choice is mask ordinances, as we are aware. And so we've got approximately 77 or 78 different emergency ordinances or resolutions addressing mask requirements in different jurisdictions. While some are similar, a lot are different. And so that's been a challenge. We do our best to try to get in contact with the jurisdiction prior to their meetings to explain, the community, the retail community in general is in support of these mask requirements. We definitely want to see those happen. The concern we have is when these local jurisdictions put the burden of enforcement onto a local business and a local retailer. We understand enforcement's kind of the concern with all of this and who can do it and how can they do it and what does it take away from. But we've seen across the nation that it doesn't really bode well because this is such a polarizing topic that when you ask clerks to confront customers who are insistent that they're not going to wear masks and possibly even ask them to not enter the building, it just becomes too dangerous sometimes at points. So we really plead with these local jurisdictions to not put that burden on the retailers, but we will do our part. We'll wear ours. We'll make sure employees wear it. We'll post signs. We can make announcements over the PA to remind folks. But that's an area that we want to try to stay away from. And so we would love to see a statewide mandate for mask to make that uniformity and to try to, obviously keep track of or help keep track or take away from having to keep track of all of these different ordinances. And so we're working with the governor's office and his administration to figure out maybe what are some available options to help with all of this. And so we've also started to see some of these mask ordinances be amended. And so again, trying to keep up, just because a jurisdiction passes one doesn't mean another one's not coming or a different version's not coming. Some locations have done resolutions to strongly urge. Now they're transferring those to mandates. And then last night we saw in your neighbor, Charleston City Council amended their mask ordinance, but they actually amended it to add items not directly related to mask, but limiting occupancy in restaurants and bars, and also limiting amplified music after 9 p.m. So again, trying to keep up with these things as they happen is quite a challenge. I've been hearing, I keep up with these local council meetings if I can, and I've been hearing it doesn't sound like a lot of tickets or anything have been issued related to these mask ordinance. I think everybody's trying to really do an educational campaign with it. And so that's what we're seeing right now. But as our numbers trend to record levels, as we're seeing, we expect to see more and more emergency ordinances at the local level, related to other things, like I said, like what Charleston just did with occupancy. So we're going to start seeing different things happen. And so that's definitely a challenge because there is no central repository for these things. So businesses are really struggling with that right now. Moving on to another topic of concern right now is a coin shortage. I don't know if you guys have seen that kind of on the national level, and we've even seen here in South Carolina the impacts of it. So the reason for the coin shortage is a couple contributing factors. One, with businesses being closed, a lot of them have the money locked up in their stores, and so it's not circulating out in the market. As we are aware, the public's not getting out and shopping, or had not been getting out and shopping as much as they had previously. So again, keeping coins out of the market. And then probably the biggest impact is the Mint has actually reduced their production of coins of course, they're having to, as a business, they're having to deal with this virus as well. So they're having to implement social distancing and deal with employees being out due to the virus. And so that has reduced entering the market for the first time. So that's also a challenge. So you're going to start to see retailers ask for cards only or exact change only to help deal with this issue. So do keep an eye out for that. Another thing that is greatly going to or has been impacting and will continue to impact the retail industry is school closures and how the state plans to reopen their schools. Of course, our employees, a lot of them have families and a lot of them have children. And so they're greatly impacted as to whether or not their schools are open or if they're doing virtual learning, if they have to be home with younger children to help with that. And so we're definitely keeping an eye on that as that evolves. I'm sure most all of you are aware today at 11 a.m., the governor, along with Senate President Harvey Peeler and Speaker of the House, Jay Lucas, have a press conference. Again, that's at 11 this morning to unveil some announcements related to school openings. So we're going to be watching for that. Another issue we're working on that I know we've spoken about previously, but it's going to continue, is liability protections for businesses as we've remained open or continue to reopen. This, of course, is extremely important to our business community to provide those limited and targeted protections for those who did their absolute best to follow the ever-changing guidelines throughout this crisis. We don't want to protect bad actors, just those who really did their best. So we're going to continue to work on that. The General Assembly is scheduled to return in September, and we expect that topic to be discussed again at that time. And then one last thing, two last things. One more thing, testing. I know Jeremy touched on this, and we are so grateful for the increased testing around the state. Of course, that greatly impacts our employers as we're trying to, limit the spread of the virus within our own workforce, but then also within our, with our customers as well. One problem that we're having, and it may just be the nature of where we are right now, is the delayed time to receive your results. It can take anywhere from 3 to 5 days on a good day to get those results. So of course, employees have to remain out and quarantined while they wait, and that reduces our workforce. So that's been a bit of a complication that hopefully, I know there's mention of the rapid results test. Hopefully maybe we can get more of those into the market and expedite this process so we can get those folks who are negative back into the workforce quicker. And then lastly, the vaccine. I know that's a hot topic and something we are all just can't wait for it to be developed and approved and ready to go. We do expect, of course, when that vaccine is released, we don't know what the plan is yet, but we do expect that maybe they will target administration to maybe essential industries at first. But who knows? So we'll keep an eye on that. But also, retail pharmacies are a big part of retail as well. Standalone pharmacies as well as your grocery stores who have them on site. And so we already, in South Carolina, pharmacists are already allowed to administer the flu vaccine. And so we'd like to expand that to include the COVID vaccine, if and when that is approved. So that's something we're working on now to be prepared when that happens. So that's the hot topics right now for retail. And Bill, I'll turn it back over to you. If there are any questions, I'll be glad to answer them.
All right, Rebecca, thank you. The first question comes to us from Deb, and Deb is asking, have you seen a lot of retail store closings as a result of COVID-19?
Deb, in South Carolina, that was an interesting topic because the governor did not mandate a lot of closures as it relates to retail. He did close a few, but he did include the option to still allow for curbside pickup or home delivery for those that were required to close. So, those that chose to close generally were going to be on a voluntary basis. A lot of our larger folks, of course, remained open to provide those essential products like groceries and pharmacies and things like that. We did see smaller folks close just due to the impact on staffing. And then, of course, restaurants. We also represent a handful of restaurants with the Retail Association. So those were mandated to close per the governor. And we have seen some open. We've seen some reclose. And so it's just kind of been, I think the majority of folks tried to remain open through all this, but it definitely has been a challenge.
Rebecca, thank you. And we had a couple other questions that you have already answered. And we thank you for being back on with us again today and look forward to having you back in the future.
Thank you so much, Bill.
Thank you. Our next speaker this morning is the president of the South Carolina Bankers Association, and pleased to welcome back Fred Green. Fred, thanks for joining us again today.
Good morning, Bill, and thanks for having me. I always learn a lot, even though I'm in Columbia, participating on this call and listening to the other participants. It's been several weeks since I've joined you because of conflicts I have had, and there's been a lot of positive things going on with PPP, many of which I'm sure your members are aware of. So I'll just very quickly go through those and then give you my thoughts on probably what's next. The time period was changed from 8 weeks to 24 weeks. The ratio was improved from 75-25 to 60-40. Forgiveness applications were published, but they were extremely complicated. There was a lot of commentary from our industry and many others throughout the country with Treasury and SBA, and then they revised the applications to include a Form EZ. The Form EZ is better than what was out there before, but again, still very complicated. The program ended on June 30, but there was plenty of money left. So Congress very quickly passed a bill, the president signed it, that would extend the program through the first week of August, and there is still $100 billion still available over the next, I guess, 3 weeks now. Within the last week, the SBA published a lot of information. Some of it was the list of borrowers by state, congressional district, and a range of PPP loans that dollar amount of the loans that they had been issued, and is basically $150 million up. So that's hit the media. Everyone had anticipated that. They also published the updated information of PPP loans made by state. In South Carolina. Through last week, we had made 63,000 loans for $5.7 billion. What is also important in that, they published the number of jobs that were protected or maintained, again, by state, and that was 60,000 jobs in the state of South Carolina. So the program has worked. Let me give you a quick update on what I think will happen next. So the forgiveness forms that I mentioned, they are available, but the process, procedures, and where to even apply has not been issued by the SBA. There is a bill that is circulating through Congress. It's a bipartisan bill, S 4117, that if passed would automatically forgive the PPP loans that are $150,000 and less, with a basic one-page simple form attestation that the dollars were used as intended. It's got some pretty strong bipartisan support in the Senate. Our industry, Bill, I'm assuming even the Hilton Head Chamber has weighed in and encouraged Congress to pass that bill. It's real important because what it would allow is the businesses that got the PPP loan, especially the smaller ones, to focus on running their businesses and not being distracted by filling out extremely complicated forms. There have been issued in the country almost 5 million loans, and if each one were to have to complete these long, complicated forms, even with the revisions, it'll be another pig in a python type event, which will totally crash the system, overwhelm the SBA, the banking industry, which is the conduit of which we have to submit it, and certainly frustrate all of the borrowers in the small business. So I'm optimistic that this bill will work its way through Congress and will relieve that pressure. I think that might be what is causing the delay in issuing the process procedures and submission information on forgiveness. Let me mention this too. Of the 5 million loans made in the country, to tell you the importance of this bill, 85% of those loans are in the $150,000 and less. So it would relieve a lot of pressure on the system, SBA, the banking community, and certainly the small business community throughout the country. So, Bill, that's a quick update. I'll be happy to answer any questions, and thank you again for including me.
Fred, another terrific update. And yes, we did weigh in on that bill, and hopefully we'll see progress on that. Thank you for joining us today. We don't have any questions, so that means that we're making good progress as we move forward with this. But Fred, thanks again for being with us, and we'll talk to you real soon.
Thank you.
Our next speaker this morning is Dr. Michael Kaka with DHEC. Dr. Kaka, we're looking forward to your update.
Thank you very much. It's good to be back on this call. So in the past week for the state of South Carolina, we're reporting 12,913 confirmed and 10 new probable new cases of COVID-19. This brings the total number of people with the disease in the state to 60,389, including both confirmed and probable cases. So for Beaufort County in the past week, this includes 478 new confirmed cases and 0 probable cases in the past week, for a total of 2,093 confirmed and 5 probable cases. For the Hilton Head zip codes 29926 and 29928, 54 new cases were reported for a total of 426 cases. For the Bluffton zip codes of 29909 and 29910, 157 new cases were reported for a total of 688 cases. So the 478 new cases reported for Beaufort County are up from last week of 402 new cases reported. So from 402 to 478. The 54 new cases for Hilton Head in the past week are down from 118 in the week prior. So from 118 down to 54. And the 157 new cases for Bluffton is similar to the 150 reported the previous week, so 150 to 157. Unfortunately, today we're also reporting 146 additional COVID-19 related deaths in the state in the past week. This brings the total number of people who passed away from the virus to 984. There's also been 9 probable deaths reported related to COVID-19. There's been no additional confirmed deaths reported in Beaufort County individuals, and the total remains at 22. No probable deaths either, so the total is 1 probable death for the county as well. So case counts do remain elevated. We saw an increase in the number of reported deaths in the past week of 41 over the previous week. So from 105 in the week before to 146 in the previous week. So deaths from COVID-19 tend to lag behind the increases in case numbers, so we may continue to see higher number of deaths reported. We're also likely not seeing a rapid increase in deaths, as we had seen a trend of identifying more cases in the younger age group, which would overall be at lower risk. However, as mentioned earlier, we are also beginning to see a trend of an increase in our average age of cases. It's creeped back up here in the recent weeks. And that may put more higher risk individuals at risk. So one comparison that may help put the number of deaths we have experienced from COVID-19 into perspective is if we compare it to the last full year of causes of death, which is 2018. So 2018 is the last year that we have, or the most recent year that we have the top 10 causes of deaths and the numbers available for. So looking at the 4.5 months of the pandemic that we've experienced with COVID-19, the number of deaths we've seen would place it as the 9th leading cause of death in the state. So that's comparing a full year's worth of data to the 4.5 months that we've seen so far, and it already places it in the top 10 causes of death. So I say all this to remind everyone of the seriousness of this disease, but also to remind everyone that we do know how to prevent infections. More and more masks are demonstrating their effectiveness at controlling the spread of the virus, but should not replace social distancing wherever that is possible. And of course, the common recommendations of washing your hands, covering your cough, doing all those other things as well are very important in controlling the disease and preventing new deaths. So as always, you can find more information about COVID-19 on our website, scdhec.gov/COVID-19, and I'm happy to take any questions.
Okay, Dr. Keka, thank you. Our first question comes from Kayla. And Kayla is asking, with the increase in testing causing a backlog, do you know what the average time is to receive results?
I don't have those numbers available. I've heard reports of some of the commercial labs taking up to a week. It can vary widely depending on what the capability of the lab is. Our state lab is still able to keep up with the numbers for the most part at this point and turn results around in 24 to 48 hours, but some of the commercial labs are having more and more delays.
Okay, thank you. The next question comes from Susanna, and Susanna is asking, are there tests available that do a mouth swab instead of a nasal swab?
The swab of the mouth, so there are saliva tests. I don't know how widely commercially available they are at this point, but I know that there are saliva tests that are becoming more and more available. The typical testing can either do a swab of the nose or the back of the throat, essentially a throat swab, but the saliva tests are looking like they're going to become more and more available.
Okay, thank you. The next question is, my son's roommate had COVID several weeks ago with relatively no symptoms, and he never got tested. At this point, is the antibody test important to assess if he had COVID as well?
No, I don't think having no symptoms, that getting the antibody test at this point gives us very much information. We don't know how long immunity lasts after infection. There seems to be some short-term resistance against reinfection, but just getting the antibody test is not going to give us a lot of useful information.
Okay, and the next question is, with the percentage of false negative tests, is the recommendations to get multiple tests?
I wouldn't say the recommendation is to get multiple tests. The recommendation is if you have symptoms that are very consistent with COVID, if there's a high suspicion that you may have a COVID-19 illness, you should take the same precautions as someone who has a positive test. Unfortunately, false positives, false negatives are just built into any test. There's no such thing as a perfect lab test, and we're always going to get those incorrect results. So the lab test, we have to remember, is just one piece of the puzzle. We really have to look at the full picture of what's happening with the patients who are coming in and make sure we're treating the patient and not just the lab result.
Okay, Dr. Keka, and that's going to conclude all the questions we have for you this morning. And we certainly appreciate you for being back. Appreciate you being back with us again, and look forward to talking to you hopefully again next week.
Thank you very much.
Thank you. And our final speaker this morning is Charlie Clark, and Charlie is the Vice President of Communications for your Hilton Head Island-Bluffton Chamber of Commerce. And Charlie, we're glad to have you with us this morning and look forward to your update.
Great. Good morning, Bill. Good morning, everybody. Great to be here. Just want to give you a brief update on just some of the ways we're getting the word out there as an organization to our community about the safety measures that businesses have put in place through our Path Forward Readiness Plan, and also getting it out nationwide in terms of what we're doing as a destination to be safe. Our recent release about the Path Forward Readiness Plan was, the press release was voluntarily picked up by over 120 different media outlets across the country, and that includes some national outlets such as MarketWatch, Yahoo Finance. Also, we had about 27 broadcast outlets pick that up, which is great. The Travel Pulse media hit that came through had the headline, "Hilton Head Island stands ready to safely welcome visitors." And that report just really talked about the various ways businesses are participating in the path forward and the protocols that they put in place to protect not only residents, but our guests and their employees. You know, we were really pleased to see that VRMA, the Vacation Rental Management Companies National Association, which represents thousands of different vacation rental companies across the country and across the world, they have modeled many of their national safety protocols, in their words, developed in conjunction with the Hilton Head Island-Bluffton Chamber of Commerce. We're just really pleased to see it garnering national recognition, not for our sake, but because it sends really the powerful message that these are protocols, safety protocols put in place here on Hilton Head Island that are worth emulating. And I think one of the most important things that sometimes gets lost in the communication related to the Path Forward Readiness story, it's not just so visitors understand what safety protocols we've put in place. It also serves as a really important reminder to them that this is a place where they're expected to practice safety protocols as well. And that's really important. You know, we're all finding ways to coexist safely, and in this not post-COVID world, unfortunately, but a post-quarantine world that strikes a balance between the health and safety of our residents with really the economic health of our community. We don't have to sacrifice safety for the economic realities that families need jobs and our economy needs to function. You know, our economy isn't closed. With precautions in place, we're going about our lives. Visitors are coexisting with residents as they have for over 50 years. I think probably CBS correspondent Peter Greenberg with CBS News, we had on the call a few weeks ago, probably said it best, talking about visitors, and that's what drives our economy here and what they want. They know you have a beautiful beach. What they want to know is, are they going to be safe in your destination? And it's what we want as a community too. So those two go hand in hand. That's part of what our Staying Safe Together campaign is all about. As you know, that's sort of the second phase, as we've talked about previously, of the Path Forward Readiness Plan. We're asking visitors to make a promise to protect and respect our environment, and that they understand that they play a critical role in that too. You know, Bill mentioned earlier in the call regarding our mask distribution. Thanks to our partnership with Lowe's, we're able to we've handed out in the last probably week and a half about 3,000 free masks to businesses that need them, as well as still doing our summer mask handouts to visitors at grocery stores and other in resorts. It's really been heartening to see that. They're very appreciative of the effort. I think it really speaks volumes about, you might hear the negative in the headlines, but everyone really is trying to do their part. And are there community challenges? Absolutely. You know, will we continue to find ways to adapt to the needs of our community and work to meet them? Yes, we will. Definitely. You know, there isn't a single business in the Low Country that isn't having to change their game for fitting the times, and that includes our organization as well. We are not immune to that at all when it comes to that. Since March, I know we're all doing Zoom meetings, and a lot of them. Since March, we've held over 75 Zoom meetings with thousands of participants on seminars, meetings that are really, really designed to get information out, connect our community, relay important information. As Daniel so aptly put it, we are changing things almost daily right now. So you'll have an opportunity to hear more on August 7th. Stay tuned. We are working with the South Carolina Chamber on their grassroots tour that they'll be doing that gives you an opportunity to help set the legislative agenda, not just to talk about it after it's done, but to help actually set the legislative agenda that meets the needs of your business. And, you know, I think we can all agree that we're living out history in the moment. Crisis can bring us together as a community, or it can actually drive a wedge in our community. And we choose option one in that scenario. And that's why we've actually launched, you may have seen it last week, we've launched our Be Kind campaign. It sounds simple, and it is. We've done that on social media. You know, we've all, I think, had the experience. We've seen something that happens to people when they step behind a keyboard on social media. So our Be Kind campaign is just something we launched, a small part of what we're doing, just reminding people, just our highest selves are there, and that we can all disagree and be kind to one another. So be on the lookout for that. We've been all around town with businesses and individuals and even visitors, helping them be part of the Be Kind campaign. So keep an eye out for that. If you're not already following us on social media and our chamber outlets, we really recommend you do that. There's lots of great information out there. So thank you, Bill. And that's what I've got.
Charlie, thank you for sharing that update. And we appreciate all the good work that you continue to do on behalf of the community. Thank you.
Thanks.
Mark your calendars for next week. We look forward to having United States Senator Lindsey Graham back with us again. So mark that for your calendar. And then let's continue working together as we beat back the pandemic. And as we're beating it back and beating it down, we also want to make sure that we're minimizing its economic impact. And just as a reminder, as Charlie said, as you go throughout your day and throughout your weeks, let's focus on being kind. Thanks for being with us. Have a great rest of your week. Talk to you next week. Bye-bye.